So I'm going to stop sharing my screen so we can see a little bit more of people online, and I will invite questions. We've got about 15 minutes, thanks to everyone keeping on time. So if you're online and would like to ask a question, just use the raise hand button or put a comment in the chat, and in the room, raise your actual hand, obviously. Yes, Chi. I can repeat it, but yeah, if you want to. Yeah, do you want to do it yourself? Well, she's going to come up herself.
Thank you. I have a question for Marie about the microbiome and whether you are measuring it at one instance in the cycle or throughout the cycle, and a little bit about what your I understand it's in process, so what your expectations are, or what sort of some background on your expectations of the variation of the microbiome through the cycle and how the different products might affect it.
Thank you very much for all your questions. As I say in my presentation, we will have a group of women. The women will use the different menstrual products, and they will give us their sample, their vaginal sample, Then once we have that vaginal sample, we will do a sequencing, and we will analyze all the microbiome, the microbiome we will find in these samples, and then we will make a comparison. Like if a woman use a pad, we will we will know how their vaginal microbiome is. If when she switch to the tampon, we know how their vaginal microbiome is, and when she use menstrual cup, we see how their vaginal microbiome is. And based on some analysis technique, we can know what impact is menstrual product had on the vaginal microbiome. And concerning our expectation, what I know in the literature is that many authors work on these three menstrual products, and they found that the menstrual cup protect well the vaginal microbiome than others. When the women use menstrual cup, they had a vaginal microbiome abundance with lactobacillus. As we also know that lactobacillus is good for your vaginal. But concerning vaginal microbiome, we also know that many other factors can influence the vaginal microbiome, like pregnancy, like the environment, your alimentation, and so on. So the Envia project, we will do this project in Cameroon, in Peru, and also in Switzerland. So with this different environment, different attitude, we will have an idea of how the vaginal microbiome is, and also we also better have the impact of the menstrual product, and also the impact of those external aspects like environment, eating habit, and so on.
Thanks very much. And also, I think probably an educational effect already there, right? Getting women or your users to know themselves what's good for their particular microbiome and what isn't so good. You know, it's both getting the data and already having an impact, right? Yeah. Yes, question.
Yes.
Sorry. Okay. If you can, yeah, that's great. Another question from the room coming up to the microphone. Marie, did you want to, Kenfack, did you want to respond to that?
I wanted to add that in our project, the thing that we also do is like raising awareness. As you know, menstrual health is still a taboo in Africa and also in another country. So in the first part of our project, we have an intimate discussion with all women. We discuss about their feelings, their fears, their what they think about, and also we provide that advices, break the taboo about this decision. And one thing important that we will do is that every woman in the project will be like an ambassador. Like we say, okay, you have this knowledge. What we advise you is that you go and share the knowledge in your influence circle. And we are confident that with this technology, with this method, they will like more the knowledge will be sharing.
Thank you. Actually, it was part of my question, but thank you, Marie. I just want to know more about your project. Do you provide the product to women? And, you know, because I know that, for example, cup in Cameroon are not very popular. So I was wondering if you also, you know, do some research on acceptability and or something around the product, or if you just measure the impact of the microbiome on women. Thank you.
Thank you very much for your question. In the Leke project, we in all the survey, we ask women about which project they use, and also we ask about their knowledge of another project like pad, menstrual product. And we ask question of women if they are willing to use a new menstrual product. So when we analyze the survey, the women who say that they are willing to use another menstrual product, we contact them for the Invara project. And also, we will also enroll women, like Haraz was intended that there is this study. Do you want to use a new product? If they say yes, they will be enrolled in the study. Concerning the product, yes, we will give product to women because, as I told you, it's a project that we made in Cameroon, Peru, and Switzerland. And to avoid bias, it's important for us to have the same product. So actually, we are looking for sponsor that we can give us menstrual product so that we can provide to women.
Great, thank you. And we've got another question in the room. Would you like to come up?
Hi, everyone, and hi here as well. Thanks a lot for your presentations. It's given me a lot to think about in terms of my work with waste workers back in India. So I think I had a question specifically around policy, those of you who've looked at it. So I think from what I understood is that there is a lot of focus on environmental sustainability. There's a lot of focus on WASH, and there is a lot of focus on product provision, right? And I think what I'm just trying to understand is that all of them seem to be very real life considerations as well on the ground, especially in our work with marginalized communities. And especially when we're dealing with policy makers and actors, they seem to want very specific advice on what to incorporate in their policy. Because, I mean, I understand that we need to say have a collective understanding of the issue, but I'm just trying to understand what specifically that entails. Because I think like we were discussing that policymakers tend to make these policies not in isolation. I feel like we're all a part of somewhat the same world, and it's not a linear process, right? Like the policymakers are also kind of depending on research or evidence as well. So in terms of as a research community, how is it that we can work towards providing more specific practical solutions that can be implemented on the ground? So I think, yeah, that's my question for the policymakers, I mean, people working with the policy. And I felt like around the definitions that people were using, right? Like the period poverty, menstrual justice, menstrual equity. So there again, like, you know, those competing framings are also seem to be emerging from the research community as well. So how is it that we as a community can actually work towards making a more collective understanding of the issue? Something that we're also expecting the policymakers to have, right? So that's just something that I wanted us to think about together.
Okay, do you want anyone in particular to ask, maybe Laura and Carla? Because
yeah,
they were
policy
explicitly.
Yes.
Sorry, you might not understood that. Maybe is that a question for you, Laura and Carla, or anyone in the room?
I think it is a question for Carla. She has quite a bit of experience.
Kind of you to volunteer her.
Thank you. Yeah, thank you, Laura, for volunteering. I mean, I think for us, what we've seen from the environmental discourse, so working from an environmental perspective, a lot of policymakers tend to just focus on the product and the trash from the product, not looking beyond any other specific topics, right? So I think we have to break that narrative into what else needs to be taken into consideration. I'm sorry, I didn't get the name of the person that asked the question, but for instance, working with the waste pickers, how is this waste being affecting them when they pick it up? How is this waste affecting the environment that the people are living in? How is that waste returning to affect the body of the people? So I think the problem with the policy making, as we see it from the environmental perspective, and I think it's been because we have not given the right recommendations, is that it's just focusing on waste and the waste generation and not really looking at the whole holistic approach of it. As we mentioned, I think we gave 5 very straight recommendations: enhancing management systems, understand the effects of climate change and the environment, establish quality standards. And I think these are not taken up by policymakers. It's just very easy to put, again, the blame on the product and the production of waste rather than actually doing something about it. So we will produce, we are planning to produce a policy brief addressing these more, these points in more detail. And I'm happy to share it with you to see, okay, which of these can actually work for your case. And I think menstrual health is very case specific. So something that could work in Latin America could definitely not work in India. It's good to compare, but I don't think it's very replicable, even though we're talking in a, right now as a global discourse. So just, I don't know if that answered the question, but that's my perspective.
Thank you. That's, when is it? I think Sophie also wants to come in on this, and you as well, Josephine? Yeah, thank you. And thank you for that response as well. I think I was going to say similar things, but I think on the terminology point, it is probably also useful to point out when the Global Menstrual Collective did bring out the definition of menstrual health was in an attempt to kind of go beyond these. But then I know there are a lot of people who work still in the wash sector who argue that keeping the word hygiene in is really important because those are still important elements. So I think it's more of a people who work in this sector sort of fighting their own battles a little bit about what words should and shouldn't be kept in. So, and I mean, personally, a whole chapter of my thesis is based on language and how we talk about it. So, and the complications of that, because there's a lot of people, for example, in Kenya, who didn't want it to be called the menstrual hygiene management policy because of the implications it had. But again, so these things are complicated questions. But I think in terms of policy development, I can speak for the example of Kenya, which is that there's 47 counties and they've got a system in which you've got a national policy, but then they call it a domesticated policy when it goes to each county. And so it's not, I think personally, a challenge is when you've got global level ideas about what menstrual health or menstrual hygiene should include, and then you go down to the national level, but then you go down to the county level. And so then I think that's probably the role of where organizations can come in at the county level and think about what specific things could be implemented there. But there's massive challenges of having a national level where you can have these big, broad agendas. And that's why I also argue that products, again, are the thing that's focused on because it was the easiest, because then you can say, oh, well, we'll just do that in all schools. But you can't say what's going to happen in every single locality, in every single county across an entire country, which is, so I think policies focus on the easiest instead of the more complicated, which is what happens at county level. Yeah.
I think Sarah has something to say.
Thank you, Sarah. Do you want to come in on this? And that will probably be our final remark. The rest we're going to have to take online. And Josephine, did you want to answer directly? No. Okay.
I think she pretty much covered it. I mean, basically, let's move past the product provisions. And there's been a lot of the research that comes out of the Society for Menstrual Cycle Research, and Chris Bobble's work is really focused on that. And I think I don't really have anything to add. Yeah, products are the easiest thing, but they end up placing the burden on people who menstruate instead of more broadly looking at education and stigma. That's all.
Okay, cool. In that case, we do have 2 more minutes. Any other questions? Or Josephine, do you want to come and add? Do you mind coming into the microphone? Sorry.
I was just going to mention that I think that reflects the need for tangible, measurable things. So pads, how many toilets have we distributed? These quantitative measures that you can then say, oh, we spent this money and it had this impact. And that seems to be the dominant thing in policy making. There's less focus on the qualitative, looking at social norms and looking at stigma and how do we measure changing people's opinions and beliefs. So yeah, that was just my Thanks.
And you know we're doing it. We're all together here bringing our shared experiences, which are both very specific to particular contexts, and yet they're things that just resonate generally. And if we read each other's work and keep pushing at the same barriers, I think we are achieving a change. So thank you so much to our wonderful speakers, both in the room and online, to the questions, to the discussion. Great session, I thought. Yeah, look forward to the next one. Thank you.